Hi, I'm Dr. Ramesh. I'm a physician. I'm practicing in Whitefield. I have a small hospital called RK Multi-Specialty Center located in heart of Whitefield. I've been practicing here for the last 14 years. I've done my MBBS, I've done my MRCP in UK. I've been practicing since 2006 here. Today, let us talk about an important topic, hypertension. So, when I say hypertension, I think most of them would be knowing what is hypertension. Our heart actually pumps blood every second or every minute. Pumping of blood will be happening from our heart. Once it pumps the blood, the pressure which is being taken by the blood vessels throughout the body is called the pressure. So when we record, then we call it as the blood pressure. So whenever the blood pressure is high, so whatever the normal values, which I'm going to let you know, if it is more than those normal values, then we call it as hypertension. So what are these exact readings then? See, there are two types of readings which we usually take. That is called systolic reading or the upper one, the diastolic reading or the lower one. Once the heart pumps, then what we're going to take is the upper reading, what we call the systolic blood pressure. Once the heart relaxes, then also there will be some amount of pressure on the walls of the arteries, that is called diastolic blood pressure. So if the systolic blood pressure and the diastolic blood pressure is measured, so usually we get the normal values, which we usually say it is less than 130/80, the systolic being 130 and the diastolic being less than 80. So if at all we measure blood pressure to any patient, and if they get blood pressures consistently more than 130 systolic and more than 80 diastolic, for example, if you keep 140/90, then we label them as hypertensive. So we actually grade patients according to the blood pressure readings as well. Like for example, grade 1, grade 2, grade 3, depending upon how much is their blood pressure. So for example, if I say grade 3 hypertension, that means their blood pressure will be more than 160 systolic and more than 90 diastolic, so like that. So coming to the what is the necessity of measuring blood pressure? It's a big question. So because we found that blood pressure being consistently high can lead to so many problems. For example, it can cause heart problems. It can also cause problems to the brain, what we call stroke. It can also affect your kidney. It can also cause damages to the kidney. Not only that, it also can affect your eyes. So we call the condition we call is hypertensive retinopathy. So it is important for us to maintain adequate blood pressure to combat these complications that can happen because of hypertension. So who are those patients who are more prone to get hypertension is the question. So it depends actually, there are a few factors. We call them as modifiable factors, and there are also a few factors which are non-modifiable. For example, age. As you get older, there is increased chances of you getting blood pressure because your arteries are going to be thickened, and they can have more pressure falling upon them. So this is the one factor which is non-modifiable. You can't really modify it. Again, one more, I'll give an example, non-modifiable. For example, family history. If at all your parents or if at all it runs in your family hypertension, then definitely there is increased chances of you getting hypertension. It's not like must and should, but there is increased chance. So these are all like non-modifiable. You can't really modify them. What about the modifiable factors? So this is very important because that can be changed. If at all we take actions upon this, then we can rightly keep our blood pressure under control. What are those things? So I'll give you a gist of a few factors. For example, obesity or overweight increases the risk of hypertension. And again, smoking is very, very dangerous. Again, increase the risk of hypertension. Alcohol consumption increase the risk of hypertension. And again, lifestyle. Sedentary lifestyle is again one more important factor where there is a lack of physical activity, which can also cause increased risk in developing hypertension. And again, diet, again, one more important fact, like having a lot of fat, the saturated fats, and again these processed foods, and again taking a lot of salt in the diet can also increases the risk of developing hypertension. So at least if at all we get to know that we have some amount of modifiable risk factors, for example smoking, alcohol, sedentary lifestyle, and again with respect to diet, we can definitely keep our blood pressure under control. Any patient coming to the clinic, usually if the patient is usually an adult or like more than 20-25 years, we usually check the blood pressure. So if it is if at all it turns out to be slightly high or high, we consistently ask the patient to check it for about like good 7 to 8 readings, especially early in the morning, and that is very important. So if at all we get to know that this patient is having blood pressure, then there are 3 things which is important to take care of it. What are these 3 things? One is with respect to, as I told you, it is with respect to diet. Second one is with respect to lifestyle modification. Then comes the medication. So if at all we can combat the blood pressure with diet and exercise or lifestyle modification alone, it's well and good. If not, then we'll usually put them on a medication. So then what are these diet and what are these physical activities? I usually tell all my patients that you can eat whatever you would like to eat, but as much as possible be aware of fatty foods, fried foods, the processed foods, and again the foods which contain increased salt. If at all you can maintain such a diet where you can take lots of vegetables, lot of fruits, grains, and whole grain food, such things if you take in your daily diet, then definitely you can take care of your blood pressure. I wouldn't really ask them to make a very huge changes in their diet. So but I would definitely say that when a patient reduces the intake of fatty foods or fried foods, reduce the intake of saturated foods, intake of packaged foods, processed foods, and make sure that it doesn't really take lots of salt in the form of like pickles or this even these chips and all those things, then you can take a healthy diet in the form of lots of vegetables and fruits, and again some good amount of polyunsaturated fatty acids and good amount of a balanced diet. Then you can take care of your blood pressure. Then what about the sedentary lifestyle, which is again a huge factor which can reduce the risk of blood pressure. Not only the sedentary lifestyle, I would put it as a lifestyle modification. For example, physical activity about half an hour to 45 minutes per day, in the form of, let it be like brisk walking or jogging or swimming or playing any kind of sport, or even for example making sure that you learn a bit of yoga or meditation techniques. And again, if these things you develop in your daily activities, then it is going to reduce blood pressure. So yeah, and coming to the treatment part, see, the treatment part is usually taken care by your physician. Okay, I mean, because we have to consider several facts. For example, the age of the patient, whether the patient is diabetic or not, whether the patient obese or not, whether he has any renal impairment, whether he has any cardiac problems. So depending upon that, usually your physician will get to know what exact medication you can go on. But the most important aspect is sticking to your medication and getting it checked regularly and meeting a physician with respect to your blood pressure. That is also most important. So every year, I think May 17th, we do World Hypertension Day to bring awareness to the people about the importance of hypertension and how easily the blood pressure can be kept in control. So putting in a nutshell, what I would say is, if at all you guys feel that if at all you've been diagnosed to have hypertension, or if at all there is a family history of hypertension, or if at all your physician has been checked with blood pressure and say that you have increased blood pressure, make sure that you stick to 3 things. One is your diet, which is being told by your physician, and again definitely the what about the lifestyle modification and regular exercises, and again sticking to your medication and regular reviews with respect to blood pressure, and if required making sure that any alteration required with your blood pressure, and again the investigation with respect to blood pressure. If at all you follow all these things regularly, definitely you can keep the hypertension and its complications away, and you can still live a very healthy and good life. Thanks a lot. So as I told you that I'm Dr. Ramesh. I'm a physician and a diabetologist. I'm working in Whitefield, the heart of Whitefield. I have a small hospital, like a 10-bed hospital in a place called Ramagondanhalli. And any queries or any concerns with respect to hypertension, anything for that matter, I'm here to help you out, guys. And I'll be more than happy to look after your health. And thanks giving me such an opportunity. I hope whatever the talk I've been given to you is going to be helpful in some way or the other way. Thanks a lot.